Ziqitza Healthcare Limited is a known name in the pre-healthcare industry and has been providing emergency response services in the country. In fact, it has been a torchbearer for the last 18 years and is deeply committed to saving lives anytime and anywhere. After all, saving lives is a deeply humbling feeling.
Ziqitza Healthcare Limited ZHL is a leading emergency medical response provider founded in India in 2005 by a group of young professionals consisting of Shafi Mathur, Manish Sacheti, Ravi Krishna, Naresh Jain and Sweta Mangal with the mission of saving lives anywhere, anytime, irrespective of people's financial or social status. ZHL provides emergency medical services through its network of ambulances, health helplines, and medical mobile units, and has been at the forefront of improving emergency medical response in India. Ziqitza Healthcare Limited derives its name from the combination of two words, Jigyasa and Chikitsa, that represent their efforts to provide the best urgent medical response care to individuals in need throughout India, regardless of their location, whether rural or urban, corporate or hospitals. The organization works with National Health Mission and multiple state governments towards its vision of serving people by providing them with a range of emergency numbers that people can call for immediate ambulance assistance, including 108, which is the equivalent of 911 in the United States. They also have a network of ambulances equipped with state-of-the-art medical equipment and highly qualified and trained paramedics.
Ziqitza Healthcare Limited was founded to address the issue of lack of emergency medical response service, or effectively lack of ambulance service in the city of Mumbai. We introduced advanced life support ambulance service in the city of Mumbai and has now grown to presence in 18 states. Our objective is to provide world-class emergency ambulance service to anybody in need of such a service when they face a medical emergency. We are now moving into the corporate wellness segment, where we intend to bring world-class processes and protocols to bring preventive healthcare access to corporate employees across India. We believe that we can play a very supportive role at the primary level, which is the pre-hospital care level, where our network of ambulances and our network of responders can respond quickly.
Ziqitza recognized the requirement for organized and professional ambulance providers in India and initiated a mission to establish the best emergency response service in the country. This goal was achieved through the introduction of two major services, namely Integrated Medical Emergency Services and Corporate Health Services. The Integrated Medical Emergency Services is an innovative, fully integrated emergency medical ambulance that provides comprehensive pre-hospital care to patients in need. Ambulances, under which Dial 108 is state government and NHM's initiative undertaken to improve healthcare accessibility in the most remote regions of a state in the shortest possible time.
All the ambulances have best-of-the-art medical equipment or trained EMT on board. The ambulances are fitted with GPS devices. Our crew have been extremely dedicated. So we are also extremely proud of our crew. And government also has been extremely cooperative and appreciative of our efforts.
Mobile medical units through which ZHL along with the government have brought quality healthcare to the rural population. These MMUs offer screening, basic diagnosis accessible to the remote localities. Health Helpline is a service that includes a 24/7 medical advice helpline number 104. ZHL also operates an emergency response vehicle under which the 112 Emergency Response Service provides a unified platform that integrates police, fire, ambulance, and other services to simplify the process and reduce the response time for the public.
ये आप देख रहे हो कि ये उड़ीसा गवर्नमेंट का सेंट्रलाइज कॉल सेंटर है, जो कि यहाँ पर 108 और 104 हेल्पलाइन सेंटर चलता है। यहाँ पर हम लगभग 4000 से 4500 जॉब आईडी डिस्पैच करते हैं। जो डिस्पैच इन द सेंस कि हम गाड़ी भेजते हैं कॉलर को, और हमें 12 से 15,000 तक कॉल आता है। और जितना भी हम जॉब भेजते हैं, मतलब गाड़ी जब डिस्पैच होता है तो प्रॉपर एक कॉलर को कितना जल्दी गाड़ी पहुँच सके, तो हम उसी का ट्रैकिंग रखते हैं। तो हम उसके लिए एक बंदे कुछ बैठा है, हर शिफ्ट में बंदे बैठते हैं, मॉर्निंग, इवनिंग, नाइट, और वो ट्रैक करते हैं। एक बार गाड़ी डिस्पैच होता है तो सीधा कॉलर के पास कितना जल्दी पहुंचे।
National Highway Helpline, under which Ziqitza operates a toll-free emergency highway helpline number 1033 in the North and West Zone, covering Chandigarh, Jammu, Uttarakhand, Shimla, Lucknow, Varanasi and East Uttar Pradesh for immediate access to medical response in case of road accidents on the highway. Ziqitza also operates boat ambulances equipped with a driver and paramedic, along with a GPS device across Odisha to facilitate emergency medical care for people living in cut-off areas. Ziqitza operates ambulances, medical rooms and occupational health centers in corporates and hospitals to provide their employees and customers prompt medical assistance during emergencies. Medical rooms and occupational health centers management services involves setting up and management of medical rooms within the workplace and medical facilities within or near the workplace. Ziqitza's team provides not only trained medical staff and cutting-edge medical equipment to these centers, but also conducts corporate wellness programs around the year. Ambulances for companies, under which emergency response ambulances are available across India within 20 to 25 minutes through a network of 10,000 ambulances. ZHL also partners with companies to help them in their CSR goals of operating medical mobile units that travel to villages for primary health checkups.
At Ziqitza have been pioneers in pre-hospital care since 2005. We initially launched the model with the rich subsidizing the services for the poor, for those who couldn't afford. Now, this ensured that the service was available to all, irrespective of their caste, creed, or income. Then came COVID, and it changed our lives. The importance of good health for our well-being and happiness is of paramount importance. We at Ziqitza believe that with our unwavering commitment to service excellence, using latest cutting-edge technology and providing innovative healthcare solution can really transform the healthcare space in India.
Apart from this, Ziqitza has played a significant role in saving lives during the global pandemic. ZHL's team has been an integral part of the COVID-19 warriors in several states, where ambulance services experienced an upsurge in demand. It was a time when most people preferred to stay at home. Yet, Ziqitza Healthcare Limited's warriors were out there, risking their lives to save others. Throughout the COVID crisis, each member of the team endured personal hardships in order to serve the citizens of the country. Till date, the team has successfully handled 1.5 million calls and transported 1.5 lakh COVID patients to hospitals on time.
When I called for 108, it was near about 1:30 a.m. That means midnight. So within 15 to 20 minutes, 108 service their ambulance reached near us. Though I was staying a bit distance from the capital, still they didn't hesitate to come. And the driver and all the crew member, their behavior was so nice, and all the facilities was there. That means we are in need of oxygen was there. I am really satisfied.
2021 मई में मुझे कोरोना हुआ था, और जैसे कि कोरोना का मतलब हालत थोड़ा ठीक नहीं था मेरा, तो मुझे अचानक हॉस्पिटल जाना पड़ा। तो इसीलिए मैं 108 नंबर डायल करके एम्बुलेंस बुलाने के 5 मिनट या 7 मिनट बाद एम्बुलेंस आके मेरे घर के पास पहुंच गया और इस तरह मैं फिर जल्दी जाके हॉस्पिटल में एडमिट हुआ। 108 का बहुत बहुत आभारी हूँ।
Ziqitza Healthcare Limited has brought positive change in the lives of common people and established itself as a prominent emergency medical service entity in healthcare in India and the Gulf over the past 18 years, expanding from 10 ambulance startup to now experience of operating 5,600 ambulances. Their 24/7 services respond to more than 67,000 emergency calls daily and serve over 48 million people across 18 states, including Madhya Pradesh, Odisha, Jharkhand, Bihar, Maharashtra, Sikkim, Punjab, and Chhattisgarh.